Inclusivity in cities and towns in South Africa is a pressing issue. This issue is especially catalyzed when South Africa's past is considered. Facing this issue should be of the utmost importance for every South African. We hold the future of the country in our hands. We as a group decided that the best way to tackle the issue of inclusivity in towns and cities is to break the issue down into various manageable parts. In this video, we are going to look at 3 parts that comprise general healthcare: agriculture, health services, and education. These were chosen as we believe that population health is paramount to the success of the working class. These issues will be addressed in a stepwise manner. Addressing health would give the excluded the tools to escape their predicament on their own terms.
Sustaining agricultural communities. Most of the country's least developed regions have a food shortage due to insufficient funds and lack of education. As engineers, agriculture can be implemented to provide these communities with a sustainable source of food security. By teaching the people of the community how to grow crops and to give them a better education and understanding on how to sustain the growth of their plantations, we can help put an end to the food shortage. The problem, however, is that these communities have a shortage of water and the necessary resources needed to maintain healthy crop growth. As engineers, we can provide them with the necessary resources such as farming equipment, clean water supply, and an education on how to overcome droughts and parasites that could lead to unsustainable crop growth. We can also implement a water monitoring system that can be designed and installed to ensure that the plantations will have all the necessary water needed to produce a good harvest.
As towns grow, a few factors can cause water pollution. 2 reasons are the physical disturbance of land due to construction and insufficient sewage collection and treatment. A lot of disease is related to water, and most rural communities in South Africa do not have running water or even toilets, so they use streams of defecation. The available latrines are situated upstream from where the community collects their drinking water. More proper latrines could be placed more spread out through communities to make it easier for the residents to use.
After addressing the appropriate preventions, we looked at how South African hospital systems can be improved. One major issue we found was the lack of communication between patients and the hospital, especially in public hospitals where there might be various African languages spoken. As engineers, we could design an Internet of Things automated communication system that allows patients to electronically record their needs and feedback. Such a system will also aid the hospital in managing patient records and supplies. This will help hospitals serve the needs of all, regardless of language, culture, or health, making the system more inclusive.
This database could then be used to determine what needs are prevalent in that specific area and where the focus needs to be placed in order to improve healthcare for the community. For example, HIV could be a big issue, then effort and resources could be focused on education, testing, and awareness.
The final part of our solution involves creating awareness of the different diseases and illnesses that are lurking in people's communities. Good examples of these include HIV, TB, and cholera awareness campaigns. Teaching people the full effect of these sicknesses, preventions, and possible healing thereof will make them more cautious and willing to work together to help prevent them. These campaigns can consist of conferences, free testing for HIV through mobile clinics and public hospitals, and talking to primary and high school students. Learning through personal contact have proved to be more effective than pamphlets or posters.
It is evident that the solution to the 3 outlined aspects of our problem will have an enormous effect on including the previously excluded. We believe that the implementation of these aspects will form the base for the previously excluded to become included. This will serve to right the injustices done in the past, along with improving the general state of the South African society. We hope that these projects are implemented and aid to implement these solutions in the future. We as engineers are equipped with the necessary tools to make a difference. It is, however, our duty to truly make a difference.